I'm Serge Pringle. Jeffery Smith is here, and you've all read or listened to his the conversation we had about how to find what makes therapy works. So maybe, Jeffery, do you want to say something, or do you want to just jump to questions?
I'd be happy to jump to the questions. I just finished a session in which we explored somebody's most dreaded fear, and it's always enlightening. It was very, very interesting. This was a situation that involved incest, and the greatest dread was the dread of finding oneself a participant, not just a victim of this of these events that went on over several years. And so it was a kind of a crisis of conscience that was the core dread.
So maybe I would invite you to say a little bit more, because that would maybe provide a very useful example, clinical example that's fresh about how this works.
Yeah, well, I think we talked about this quite a bit in the last podcast, but I'll just recap a little bit. That I think that the insight that is kind of at the core of my thinking, and that brings all different psychotherapy techniques together, is this amazing phenomenon of where the maladaptive, the problematic responses that people have start with some sort of a dreaded emotion that the mind scans the environment and detects some sort of a danger, and that danger then is experienced by the mind as a dreaded emotion deep down in the limbic system. And that's what then triggers a response that gets the person in trouble. And so when we want to repair that, when we want to help, what we want to do is to reactivate that core dreaded emotion. And at the same time, I call that the dread. And there are many experiential ways to activate that. And verbal exploration is another way. And then at the same time, we need to provide the person with what I call the antidote, which is some new perspective, a higher perspective on those events that takes away the fear, that takes away the dreaded nature of it. And so when we're experiencing our worst dread at the same time as we're experiencing the antidote, then that's what makes healing happen. Recent neurophysiology tells us about this reconsolidation, but it's that core juxtaposition of two very different experiences, the one, the terrible dread, and the other, the antidote. And I was just talking this morning with this person about that there are different kinds of antidotes, that sometimes when the dreaded thing is something that you're terribly afraid of, then just experiencing that in a context of safety in the office of your therapist, or in a context where there's nurturing and warmth and it feels okay, that's healing in itself. But there are other things, like, let's say the person got frozen at a point where they would want to lash out, and they couldn't because it was too dangerous. And there the antidote might be actually physically feeling your body, pushing back or counteracting whatever it was that was done. That might be the antidote that's necessary. And so anyway, I think this juxtaposition of two opposing experiences is really the core of what goes on in all kinds of therapy.
Great. So maybe inviting people, any questions you have on this process. And so, yeah, I don't see the
Hi.
name. But
Hello, I'm Becky. I'm in Ohio, and I listened to your video and am trying to grasp and understand. So the antidote that you were describing, I know there's different antidotes, and I've been in counseling where I've had a connection that was therapeutic. I guess I'm thinking about a trauma that occurred like before a sense of self had been created, such as an adoptee being separated from the birth mom. I'm wondering, I guess, the difference between like a one-time traumatic event and or a long-term experience of dread. I'm not really sure what I'm asking, but I'm interested in hearing more. So
This comes up quite often, and I think sometimes a one-time experience is so unique and terrible that it leaves some part of yourself stuck and unable to process that and move on. And so then a lot of development that would normally happen after that may be stopped really and not take place as it should. But it's also sometimes happens that a one-time bad event in a context of let's say a healthy family does allow it to be processed at the time, and then it just kind of fades into the past, and it's a piece of history. So I think what we're really talking about is with this juxtaposition is a chance to process something that never got properly metabolized in the first place. But adoption is really complicated because adoption leads to then wondering, well, why was I given up? Why I'm working with somebody now who found out later that that her birth mother gave her up, but then had other children and had a regular family life. And why did she reject me? And how callous was that to throw away one kid and then keep the next? So I think that it's something that can have repercussions that go on in a person's mind for years and may evolve after that. And each one of those realizations can be traumatic in itself.
yeah. So just checking for other questions. So we had some people submit some questions who could not attend. So if I could certainly read one of those questions, but want to first give a chance to people who are here if there's a question you want to ask. So one question was, Jeffrey made the distinction between extinction and reconsolidation. And, while you were clear there, it seems some people have difficulty finding exactly the difference between both.
Good. So let me say a little bit more about that. So extinction goes back to Pavlov, who found that if you rang a bell and an animal experienced fear or hunger or whatever it was, and then you so you rang a bell and you provided an electric shock or a piece of food or something like that, and then you kept on ringing the bell and nothing happened, eventually the response would stop. And so he called that extinction. And it's only fairly recently that neurophysiologists have figured out exactly what's going on there. What happens is that the cortex learns that the bell ringing or whatever other signal it might be is no longer connected with the bad thing happening. And so when the cortex realizes that the connection is no longer there, then it begins to send inhibitory signals into the limbic system where these responses are triggered in the first place, like a startle response, or a soldier who hears a loud bang and suddenly is down on the floor. Eventually, if that's repeated enough times, the signal, the loud noise or the battlefield sounds or something like that, then the fear response begins to fade and goes away. And it turns out that the reason it fades and goes away is not that the alarm bells aren't ringing inside the brain. They are. There's the amygdala still lights up on scans, but the response is inhibited, doesn't happen. Which is fine, and that's the treatment that is recommended by the Veterans Administration and used around the world. It's rather brutal for the person who's experienced that, because they have to go through remembering their traumatic experiences over and over and over for this extinction to ultimately take place and work. And it has another problem because it's not permanent. It has to be reinforced periodically, because if the brain, eventually the cortex stops sending those inhibitory signals and the old upsetting response comes back again. And so not terribly satisfactory, but it does work. But then right around the turn of the 21st century, around 2004, neurophysiologists began to figure out that there was another mechanism that did the same thing, but did it permanently, and it didn't require reinforcement to continue. And that is what's called memory reconsolidation. And that's where, when you have the activation of the original upsetting emotion and the antidote at the same time, the original programming that said this is dangerous would become volatile, would become subject to reprogramming. And the reprogramming could be done according to the new information, the antidote. So the person's response would actually get reprogrammed, and in those cases, the amygdala doesn't light up anymore. It's done. And so that kind of cure of healing takes place and is permanent and doesn't require any reinforcement to keep it in place. Now, the amazing, remarkable thing about this is that the conditions for those two mechanisms are almost the same. So far, it's not 100% clear, but the research is indicating that if the reactivation of the old pattern and the exposure to a new pattern happen at the same time and are quite intense and complete, then reconsolidation takes place. If that happens once, maybe is repeated twice, maybe even 3 times. But if you keep on repeating the traumatic experience, that's what makes the cortex start to learn something. So the more repetitions that aren't as intense biases towards extinction, and less repetitions that are more intense biases towards permanent memory reconsolidation.
Yeah, so in the example you gave, for instance, you say that it's something that's recommended by the Veterans Administration. It's not that there is probably an enormous difference in principle, that sense of revisiting the experience. Mm-hmm. But in the case of the treatment, say for veterans, it's about time and time and time again coming back to that in a manageable dose. Whereas in the case of memory reconsolidation, it's something that is more intense, but is a renegotiation of the experience, because there is more than simply this happening in therapy, but something that allows the person to see that there is the possibility of a different response and a different outcome.
Yeah. I'll just tell you about how I first got involved in this, and how I first kind of clinically discovered what now I know is memory reconsolidation. In the same year that the memory reconsolidation was described in the literature by a guy named Nader, I also had a paper published which described an event that happened in my own practice, in which I was working with a woman who had been terribly traumatized in her early life. Her mother was psychotic and did some terrible things to her. And it took us a long time. It took us about 4 years of therapy to get to the point where her dissociation evaporated and she recalled this first of several terrible experiences. And so I arranged for some prolonged sessions, and maybe it was an hour and a half, that we just spent time going through those experiences. And afterwards she felt tired, but where before she had had a complete dread of getting anywhere near those memories, now they were just a dull ache. They were something bad that had happened, but it didn't have any of that emotional charge that it had before. So I was a witness to very rapid healing over a matter of hours. And that was just amazing to me that this could happen. And later on, then we started to work on her low self-esteem, which turned out to be much harder to deal with and took a lot longer. And it said to me that, wait a minute, there have to be two different change mechanisms going on here. There's whatever it is that's helping her with her low self-esteem is not the same thing as what happened in those couple of sessions where we went through the traumatic events. And so what I realize now is that what was rather unique about those experiences was that the traumatic events were re-experienced in practically 100% of their original form. Why? Because she had blocked those out through dissociation right when they happened. And so she had absolutely no recall and had not revisited those memories since they happened in the first place. And so now, many years later, she was in her 40s, many years later, that recall was as if it had happened yesterday. It was completely fresh. And I think those are the perfect conditions for memory reconsolidation to take place. And we both knew at the time that this was permanent, that this would she'd never go back to the kind of dread that she'd had before. And in fact, that's the rest of the therapy showed that this was permanent healing. Let's see, I always have trouble with remembering his name. Maybe you'll help me with that. But there's a guy who's focused very much on memory reconsolidation in therapy, who has a unique proof about when you can say that memory reconsolidation actually happened. And that is quite simple. If somebody experiences change in therapy that is permanent and doesn't require reinforcement, then we have no other explanation other than memory reconsolidation to explain why that happened. So if we can all think of many instances in our therapeutic experience where there was that kind of amazing sudden change that took place and it was permanent, right? Yeah. So I think that to me is the evidence that memory reconsolidation is a real fact. It's a major factor as we do our work.
Right. So we're talking about in some way matching the intensity of what caused the problem in the first place.
Right, which is why a lot of the experiential things like EMDR is a way of, I think, of sidelining the intellect so that we just get pure feeling and experience. Psychodrama is another way. Verbal exploration, I think, is underrated as a way of helping people get back into the feelings of an experience that they've had. And there are many others. I think you've talked a lot yourself about focusing, and if I understand, that has to do with how to be fully in touch with experiences that have been important in a person's life.
Yeah, that's it's getting into the felt sense experience. So that it's bypassing the words. In fact, the approach of focusing is about pushing back from the urge to attach words to an experience at first, so unfocusing at first, in order to get to the intensity of the emotional experience, and to create enough safety to be able to stay with it long enough to be able to see it in a different context than the context in which it had been encoded before. So in a sense, I think of focusing as very much the DNA of this process of memory reconsolidation, because it's about training people to be able to go into the experience, stay with it, and be open to it being reconfigured as there is a different way of looking at it.
It reminds me of something that I'm not sure if the people in the audience are therapists, but is a really, really useful thing to be aware of. And that is that when people do get close to their emotions, clients in therapy sessions, there's a very strong tendency to veer off within a few seconds and talk about, oh, well, yes, but my mother was doing the best she could, or something like that, that takes away the feeling. And how important it is for us to recognize in that moment that there's something important going on. There's an emotion that's being experienced. And we need to say, wait, just hold on to that feeling. Let's stay with the feeling for a minute. And it doesn't take very long, but if we let the natural tendency to skitter away from emotions, if we let that happen, we've lost the opportunity.
Yeah. So that would be, to me, a major clinical consideration. That sense of this is the moment where change happens.
Yeah.
And it's not keeping the feet to the fire in the sense of torture, but it really is staying where, the possibility of change happen, instead of just zooming past the exit on the highway and just, continuing the way there.
Yeah. Apropos, the thing that made me kind of think of this, just of applying the word, the dread, to what people are most worried about, is how much clients naturally want to talk about their maladaptive behavior and all the consequences. And I drank again, and it caused all kinds of trouble in my life. And they'll go on and spend a whole session talking about the consequences of something they did. But that's not what we need to be talking about. We need to be talking about what led to that thing happening in the first place.
Yeah. So I want to just check if anybody else has questions. So again, I have some questions that were sent before, so I can go to, but just giving a moment to see.
Yeah. We'd love it. We'd love you to speak up.
Actually, what curiosity would be of the people who are here, if they have experiences as therapists, or maybe in their own therapy as client, of a moment like this happening, and want to share it and check whether this corresponds to what, Jeffrey, what you're talking about.
Well, I will add one thing to it. So when my client, the original one I talked about, who had the terrible traumatic experiences, when we began to work with her low self-esteem, it turned out that that really had to do with a value system. And if you think about values, when we do things that are in sync with our values, we feel pride. And when we do things that are out of sync with our values, what do we feel? There's shame, badly about ourselves and so on. And low self-esteem is right in that realm of bad feelings about oneself that go back to an internalized attitude or value. And what I found is that those actually are not as easy to change as traumatic memories. They actually are very resistant to change. And changing those probably amounts to having to adopt new values, and it's a whole nother subject. But I just want to say that not everything we do in therapy is able to change so rapidly and almost magically as these kinds of things, these situations where memory reconsolidation is a useful technique. It covers a lot of psychotherapy, but not all of it. And so when I run into somebody who experiences shame that they shouldn't, I say to myself, oh, there's a value system in there somewhere that's going to need to be replaced. And we're going to need to work hard. And the phrase that comes to mind for me is kitchen sink. We're going to need to use every technique we know to help that person overcome an attitude or a value that's deeply internalized in their system.
Yeah. Somebody through the chat is cannot come to the live, but is wondering if we could address implicit memory in this context.
Sure. So I think one of the things that's really been kind of important, I think, in looking at psychotherapy from the point of view of the 21st century is that now we understand how information is encoded. We learned how our genetics are encoded in DNA. Well, memory turns out to be encoded in a different way in what are called neural networks, which are groups of neurons that tend to fire together, and that when one fires, then the whole group goes as a group, and that group comes to represent a piece of information. Well, the point of that is that just like we know now with your computer, that your computer's memory banks can hold sounds, pictures, ideas, words, anything you want. And in the same way, these neural networks in the brain can hold all kinds of different things. They can hold the memory of a conversation or the knowledge of who was the first president, or they can hold things like how to drink water out of a glass, which is implicit. It's just something that you just know, not something that you learned, except you really did learn it, but it's carried in a way that doesn't have any words attached to it. And so I think there are different kinds of memory, like implicit memory and biographical memory that we can differentiate. But in my mind, they're not terribly different. They're all information. And I think that memory reconsolidation can take place with the reprogramming of implicit memories, and it can also involve reprogramming of more verbal or the opposite of the words.
Explicit memories, yeah.
Explicit kinds of memory, yeah. So, but the implicit ones tend to be things that are more deeply ingrained. They're often things that were learned earlier in life, and so and those are places where I think that if we're going to reconstruct those things, it needs to be very much experiential. we kind of have to speak the same language that the information is encoded in order to change it. So I'm just thinking that, I'm working with somebody right now who's got you could call it a schema, a piece of implicit memory that, and when he's triggered in a certain way, his wife is just a very, very difficult person who's never going to change. And it's extremely hard for him to realize that the reason she's difficult is because he's behaving in a way that makes her difficult. But he can understand that intellectually, but to incorporate that on a deeper level, that his behavior is going to need to change if he's going to see her be the person he wants her to be. And instead his mind keeps operating as if this is just the way she is. She's always going to be that way. It'll never change. And the only thing he can do is to try to find some relief from this difficult person he's living with. Now, it can be, implicit memories can be very, very difficult to awaken and make accessible to this process that we're talking about.
So I want to add something that's looking at it from a different angle a bit. The notion of implicit memory, implies or relates to implicit process. And so when we are in that area, we really are more obviously in the territory of process, that is, of interaction, of what happens, as opposed to things that are stable. So there's a dynamic model and a model of engagement. You're talking about not just, here are the way things are. For instance, this guy's wife is a certain way, or whatever other circumstances is a certain way, or that circumstance, that wife changes. But it's pushing us to look at it on a phenomenological point of view, in terms of everything happens in a model of interaction. And, how I interact with this situation is going to actually change the situation. And so that's where there is, an experiential quality to it. That is, you cannot understand it from outside. At best, what you can get from outside is a sense of curiosity about possibly engaging it differently. And then as you engage it and the outcome changes, is the possibility for memory reconsolidation.
Yeah. And so that way, the antidote is created by doing something just a little bit different in the interaction.
Yeah. So just checking any other questions. So meanwhile, while maybe you think about that, some questions that were asked is any way to see signs as we're dealing with clients that memory reconsolidation is happening?
Well, so I think that the clearest indicator is when we see affect. Affect is, to me, is a very, very important word. The definition for me is affect is the experience of feeling, which is a conscious experience, plus some bodily change. It might be your hair standing on end. It might be feeling anxiety in your tummy. It might be your heart rate going up. But when the body responds, that tells me that this is emotion that's not just conscious, it's going on deep in that limbic system. How do we know what's going on in the limbic system? By affect, pretty much. That's our only indication as clinicians and as human beings that those deep emotions are being activated, because otherwise we really don't know. Just as we can't tell what emotions animals are having, we can see that the way they react is the way that we would react under a certain circumstance. So your dog loves you. but you don't really know what a dog's experience is like. It's really not possible. And in the same way, it's really not possible for us to know what is going on in our deep limbic system. The only thing we have is this little window, a little porthole of consciousness that tells us a few things about what's going on in our brain. In fact, estimates are that about 95% of what's going on is outside of consciousness. So affect is really, really important. It's our best clinical indicator that there is an activation going on that would make that person ready to experience their original toxic experience along with an antidote that would change the perspective on it. And I think and so I think that affect is just super important to us as clinicians and as people. And of course, we're talking about affects that are not comfortable. And so how strong is the instinct to stay within our comfort zone? It's pretty powerful. And we have a lot of tricks to maintain that. And of course, that's what keeps the status quo going. That's what prevents people from experiencing change a lot is that we tend to avoid the very kinds of experience, the very kinds of affects that are indicators that we're ready for change.
Yeah. So what we're talking about is in the therapy situation, we're co-creating a safe container where it is possible for clients to experience what it is that they are essentially unconsciously scared of.
Yeah.
And experience it in a safe enough way and for enough time and with enough intensity that it is possible to actually find a way to engage with it differently and essentially to see that, the past experience is not destiny, that there is a way in which different way to engage can bring a different outcome. And that lesson is learned in a deep way.
Yeah. I wonder if the people who are attending, how many of you are taking in the Olympics? Well, I think we have in the Olympics, there's a very interesting example. What is her first name? Ms. Gu.
Eileen Gu, I love that
Gu.
article of hers in the Times. It was
Okay.
Wonderful.
And what she said was that she became addicted to fear. She loved going into places where she was scared. And those are strong affects. And so how do you keep improving to the point that you become a gold medal Olympic champion? It's by continually going right into the monster's mouth, right into the things that she's most scared of. And that creates these experiences where something new gets acquired and where the fear gets attenuated, so she's not afraid to do these crazy wild things and pull it off. So I think that's a lovely kind of everyday, well, not every day, but it's an example on the other end from psychotherapy of how these same principles operate throughout life.
Yeah. So just
I'll go ahead and speak up and sorry to be a lurker here. But I just as Jeffrey, I was just recently became familiar with your work and your blog, and so I knew you were doing this, so I didn't know what the format would be. So I'm sort of unprepared here, but thank you for this discussion. It's Serge and Jeffrey. So it's really very interesting, I guess if any question has sort of occurred to me in the course of this today, I would say I'm a psychiatrist in Ohio, incidentally, who does psychotherapy. So the question that occurs to me is, could you say something about about the grieving process and this. That is it's not a traumatic event like an assault or anything like that. And there's this phenomenon of assuming that it's I'm working with a fellow who's traumatized by the death of his cats, and it's been very interesting. But obviously, more usually, a person who's been lost, and the what they used to call the introject of that person, kind of stays very, very much alive and present, and in complicated grief, there's a mix of emotions around the person or around interactions with that person, and I guess I'm asking about the sort of the phenomenon of stuckness in your model, about when somebody is stuck in their grief, which happens quite a lot, actually.
Well, as a student of change processes, I'm quite aware that grief is not quite the same, because unlike these healing of traumatic events, let's say, grief seems to have a time course of its own. It may be short, it may be long, but it takes its time, and it feels like some kind of work is being done each time the person revisits the painful sense of loss. And so I'm sure that there's some neurophysiology involved in that is different, and I don't know how much overlap there might be. When I think of grief nowadays, I always go back to the image from a documentary of some sort showing a mother elephant whose baby has died, and the herd is going off to wherever they have to go, and she stays behind for several days, just hanging around the body of the dead elephant, and then finally lets go and goes on her way. So I don't think that grief is something that's unique to humans. I think other mammals experience something that must be pretty like that. But complicated grief, where a person gets stuck, I think is different, and I think there one could begin to apply the things that we've been talking about. The question that would come up for me is accepting this loss and moving on after there's this kind of natural grief process should be done. There's something that's blocking that, and so I would ask, what is the dread? What is the dread that's involved in letting go? Is it a feeling of, then I would be committing a betrayal of the dead person? Is it, is it a fear then of moving on? So it's certainly complicated is the right word for it, because that is quite, I think, individual and unique, how in what way a person might get stuck and not be able to move on after the grieving process is finished or should be finished.
Thanks. That's helpful. The anecdote of the elephants is very, very good.
Yeah, it's just it tears my heart out every time.
Yes, I've seen videos of that. Yes.
Yeah.
Okay.
Well, anyway, thank you for speaking up, and I'm glad to see actually the face of somebody who's read my blog at psychotherapyworks.com. I'll put in a plug, and I might as well plug my textbook of psychotherapy, which is also featured on the website howtherapyworks.com.
So is this a good place to end? Just checking, giving a chance to people if there's another question. Otherwise, it might be a good place to end. Okay. Yes.
Okay.
You have a question?
Yes, thank you. Well, first, I'm also a recovery blog.
Thank you.
Yes, it has been incredibly enlightening for me in my practice. I'm like visiting my framework, the things I do, and it really has been amazing. I live in Mexico. I apologize for my English if something is not very understandable. And I just want to say what you shared about memory reconciliation, and then how the kind of help, the kind in the circumstances we can use it, and it's very helpful, and it's almost like an aha moment. It seems almost like magic, how it happens, how our clients seem to let go of all the grief or the attachment to that specific memory or specific trauma. And then this whole other thing of the like self-esteem. And I've seen that a lot, especially with my female clients regarding body image. And it's very clear. I just have one client. We have worked with memories regarding her father, and in those subjects, I've seen how the memory reconciliation has been almost like magic to her. But regarding her body image, it's like you said, we have to work a lot of things because it's values, and almost is that she now is in the process of understanding how the values regarding body image are very unfair and very absurd, but she still feels inadequate. It's like that double. She understands, but she still feels like I understand, but I don't feel those standards, so I'm not pretty. I don't like my body. I don't like, and that I found that is more difficult for her than the things regarding her father.
Yes. I totally understand that. And, I think that in our field of psychotherapy, there's really a problem. I think it maybe the superego used to be pretty important, the conscience. I think what happened is in the 60s, it became out of style to talk about good and bad or conscience or anything like that. And so if you do a literature search on conscience, most of what you get is people in criminal justice, and yet for me as a therapist, understanding that values are different. They're not the same kind of mental contents, and they don't work the same way. And they do require a across the board, broad-based effort to install a healthier value on top of the old one. I actually, my best guess is that values are indelible, that they don't ever go away. The best we can do, and the evidence for that is that people can always relapse, even if they've adopted a new, healthier value. A few bad things happen and boom, they're right back where they started from. So old values and unhealthy values seem to be pretty much indelible, but you can install new, healthier ones on top of them or reactivate healthy ones that existed before that. But this is something I like to talk about because I think it's something that is just about not recognized in official psychotherapy theory. There's EMDR, Shapiro, who invented EMDR, at least recognized that values were different, and that it took a special procedure to try to change those things. But most therapies don't even recognize the difference between, let's say, a maladaptive schema and a value. They don't operate the same way. And the way you can tell that you're dealing with values is when there's pride or shame involved. That's the sure sign that this is something. And I'll just go on and say one more thing about this, that again, going back to neurophysiology, it appears that that even though there may be some roots of those things in history, that values come from the feelings of shame and pride come from the cortex. They don't come from the limbic system originally. I think they wind up there because they have such power, but they do originate from the cortex, and that's different from all of the other major feelings that we're dealing with. So I'm very glad to hear that you're recognizing that difference and giving it the respect that it really deserves.
Yes.
You know, very many times people will say, oh, values, that's an easy thing. You just do this, this, and this, and it doesn't work that way. Yeah, I'm with you.